Welcome back to the show, guys. We have a really important episode for you today. If you follow me on Instagram, you know that not too long ago, I posted a story about the harmful effect of too much screen time on small children's developing brains. This episode touches on that topic and a lot more. And I think it's one of those episodes that whether you're a parent, you're the parent of parents, or even for those of us who are adults, this is really important stuff to start to get our heads around so that we can start to take proper action to protect ourselves and our small children's brains. But before we jump into the episode, God, that sounds so serious, right? Well, it is a serious topic. I think it's really important. But before we jump into the episode, I would love to tell you about a couple of new things in my world that might actually become things in your world. So the first new thing in my world is that I am basically creating a space as part of my large membership community. It's basically a tier of the membership community. It's not the full whole hog membership community with the live Q&As with me and the live Q&As with podcast guests and the whole nine yards. This is a subset of that community for people who aren't quite ready for that big a commitment, but who are looking for an alternative to the big platforms like our friends over at MetaHost, because they're starting to make it really hard for communities like mine and many others. Last I heard, they closed 27 similar communities to mine in a week. They're just making it really hard for us to exist because they're quite restrictive in terms of what we can talk about, the words we can use, the topics we can embark on. So I want to give people an option to that environment, which is becoming really, really difficult to manage. Unfortunately, I can't do it for free. Facebook is free, and that community, for as long as Facebook allows it, will remain there, but it's at risk of going down. It's on probation right now, actually. It's a lot harder to find. If you're looking for an alternative and a safe place and a place where there's no censorship, and we're still going to have moderators and that kind of stuff, and I'm going to be loading in some of the resources from the Facebook group in there pretty soon, you can join us in the Peptide Parlor, is what we're calling it. There will be a link in the show notes. The investment of the Peptide Parlor is very small. It's $5 a month or $50 a year, which gives you 2 months free. And that gives you access to the Peptide Parlor. We've got a whole bunch of different resources in there. And really, it'll allow you to connect with like-minded people, talk about all the things that you want to talk about without having to really worry about getting kicked off the platform or drawing a foul or whatever the case may be. So that's the Peptide Parlor. We still have the membership community, which is a much bigger deal. It's a bigger investment for sure, but you get a lot more for that. I kind of described that a minute ago. To find out about both these things, you can head over to natnidham.com. That's my website. You can sign up for my newsletter there. There's also a peptide specific newsletter, and you can find out about the longevity membership community or the Peptide Parlor. Both are available to you depending on which way you're leaning. And beyond that, I just want to thank you. Thank you so much for being here. Thank you for allowing this podcast to grow by leaps and bounds the way that it has. Thank you for allowing me to do what I love every single day. If you've ever wondered why so many people seem anxious, distracted, or stuck in loops, this episode is for you. You might even be one of those people. I know some days I feel like I am. I'm joined today by Dr. Robert Melillo, a clinical neuroscientist who spent nearly 4 decades decoding how our brains develop and how modern life is throwing them off. We get into why conditions like ADHD, OCD, and anxiety might not be lifelong diagnoses, but signs of the brain's left and right hemispheres falling out of sync. He explains how our tech-obsessed world, especially screen time for kids, is overstimulating the left brain while underdeveloping the right, which handles emotional regulation, self-awareness, and connection. In other words, handing your toddler an iPad might not be the win you think it is. Dr. Melillo breaks it all down and shares how to start rebalancing your brain, no neuro degree required. If you want to learn more about what we discussed here today, you can visit his website, drrobertmelillo.com. That link will be in the show notes. Hey folks, just a quick reminder that all of the information presented in this podcast is for information purposes only. No medical advice, no diagnosing, no treatments suggested here. before you try anything that you hear about or learn about here, make sure that you check with your medical provider. Dr. Melillo, welcome to the show. It is a pleasure to have you here, and I'm very much looking forward to this conversation.
Me too. I'm excited, especially since our pre-conversation was so exciting. So I can't wait to get into it with you.
I know. Well, the pre-conversation, quite often, I think I should probably just start recording those, because we can probably grab a bunch of gems even just out of there. But it's good to get a little warmed up and get going. So, I think as a way to get started, let's talk a little bit about you and what you do. I mean, you're a total expert in your field, and you really look at, in this podcast, which is about longevity, we tend to focus very much so on adults. And we're going to talk about adults today because the brain is an organ we need to, I don't know, cultivate and take care of from the minute we're born until our last breath. But you do have this expertise in developmental brain health. And so I'd love you to talk a little bit about your background and your area, your kind of zone of genius. That's what I was looking for.
Yeah, I mean, I've been a clinician for really almost 40 years, and I've been a researcher and postgraduate professor in clinical neurology and rehabilitation for most of that time, and especially my expertise. I have a PhD in developmental cognitive neuroscience. I also have a degree in clinical rehabilitation neuropsychology, but I started out my career as a chiropractor. And got a diplomate in neurology right after school. So I got a board certified in neurology and rehab, and then went with neuropsychology and neuroscience. So this has been a lifelong study. And I've been doing brain research of some sort, publishing. I've published over 100 scientific papers. I've published my first textbook. I started writing it in the 90s. I really wrote it in 1999. We published it in 2004, called Neurobehavioral Disorders of Childhood, an Evolutionary Perspective, where we really looked at what is actually happening, why are we seeing this epidemic rise, which we were just starting to see in the 90s and early 2000s, actually starting really in the 80s, and, really trying to understand it. And what drove me also was, besides that was my interest, both educationally, clinically, professionally, my kids had issues. And my oldest son was diagnosed with ADHD. So I really wanted to understand what was happening in my own child and then other children. And so that's what kind of led me to this. And what's kind of cool is that my textbook, Neurobehavioral Disorders, it came out in 2004. And Springer, who's the main publisher, actually came to us this year and said, your book is still very, very popular book. It's been one of the most successful textbooks we've ever had. And we didn't know that at all, but that people are still buying it. And they said, we want you to actually do a second edition. So 20 years later, we're doing a second edition. And it just speaks to the fact that when we came out with that book in 2024, I think it was already 20 years ahead of its time. And now, people are coming to our work in that level. So, that's my expertise, is looking at, it started with me with my own, someone tells me my son has ADHD. My first question is, what does that mean? What's actually happening in his brain?
Yeah.
Because I'm thinking, what can I do to change it, right? How can I rehab that? How can I fix it? And I know a lot about the body, and I know a lot about diet and nutrition. I know a lot about the brain and brain development. And how can I bring all that to bear to help my own son and then help other kids? And that's what led me to develop my clinical model called the Melillo method. Yeah. Before that, I created a model called the Brain Balance Program, which we, brought out to over 100 centers across the United States in over 10 years. And they're still around today.
Yeah, there's so much in there I want to talk about. And I think we touched on this a little bit before we hit record. And how much do you think there's so much has changed over the last 20 years, and the pace of change in technology is dizzying at this point. Like, it's every time we turn around, and it's accelerating. I remember way back, and I can't remember, I couldn't tell you when it was, but there was a video. There was like this really cool video that came out that talked about, in the amount of time it took for humanity, let's say, to develop the radio, then how long it took to develop the TV from there, then how long it took to develop the first computer. And then all of a sudden things just start to accelerate and accelerate. And this would have been, this had to be at least 20 years old, this thing. You can only, and the point of this video was the rate of change and evolution that we're undergoing was at that time unprecedented. And now I'm sure is beyond unprecedented. And on the one hand, we have the brain that is plastic, that is adaptable, that can grow, that can change, that can evolve. But on the other hand, we've got this pace of technology that I would think is outstripping our ability to adapt in real time at this stage. And so, how are you seeing that kind of play out? Like, I would think, as you're going back to your book that's now 20 years old, how much new material are you going to be putting in there?
Um, a fair amount. I mean, I just also came out with the third edition of my book, Disconnected Kids. So that's a book that I first published in 2009, 2010. That is one of the best-selling books of all time in that genre, and is translated into 18 languages. And we just came out with the third edition. And for it to be a new edition, you have to add at least, 30% new material.
Yeah, I would think that's not a problem.
Yeah, so that we'll probably be adding a lot more. It's even harder with a textbook because we have so many references and that have to be updated and all of that. But yeah, the pace of technology change. But again, it is the human brain that is also creating these technologies. So meaning there are people out there that are using our own brain to advance this technology, but then also the use, and also when it becomes, we mentioned earlier how, I'm a big believer that I want eventually people to be the expert of their own brain. Mm-hmm. Because I think one of the reasons why the pace of technology has increased is because, you're probably a little younger than me, but when we were younger, there weren't any computers. And then there were some computers, but in the beginning, the average person didn't understand it. It was a whole different language. It was DOS language, right? So you had to get an expert to show you how to use it or to literally do it for you. Mm-hmm. And I think that's how people are with health and brain health, especially right now, that they feel like it's way too beyond them and they need to be able to use some sort of an expert. But at a certain point, in the early 80s when we developed personal computers, and then especially when they came out with the iPhone and people started to be able to use it themselves, now most people are kind of almost a computer expert. Yeah. And what used to be looked at as a computer expert years ago, the average person and child knows way more than them now. Mm-hmm. Mm-hmm. So once you make it ubiquitous and you put it in the hands of people where it becomes self-generated and user-friendly, then what happens is you learn on your own. Mm-hmm. And you become an expert in that, so that, now most people are pretty fluent in how to look at their computer, and if something goes wrong or if something's wrong with their phone, what they need to do, or if a new app comes out, or they can go on YouTube and they can self-generate it. And I think I'd like to see that happen with the brain, where we get to that point where people feel comfortable. And then I think that we can actually maybe change this trajectory of this epidemic that's been happening.
Yeah. Well, it's interesting you say that. I think up to a certain generation, that's true, right? You look in the 70-year-olds and the 80-year-olds, like my parents, God bless them, like they use their phones and their computers, but they're pretty bloody baffled. Like this is way, I know that I took a computer programming course when I was in university and, produced reams of wallpaper one day because I wrote the wrong loop or something. But right. So it's just interesting to see generationally how people's comfort level with these things has changed. But I love this idea of helping people to become literate about their own brain, so that they can now take a much more active role in understanding am I having an issue, and how do I go about fixing it? Because I think, or addressing it even from a lifestyle perspective, and I think that that's where, certainly in the biohacking community, you've got people who are deep into this, right? They're messing around with, all kinds of, both from a nervous system regulation, understanding that if you can regulate your nervous system, then all of a sudden your brain is free to work, right? Because if we're in a sympathetic state all the time, brain doesn't function. It's just in a holding pattern trying to survive. But also things like neurofeedback or different technologies. There's all these different technologies out there right now, like both wearable and and going back to meditation, and being seen as ways to kind of hack the brain or help the brain to be more functional. Then we get into the space of nootropics and all that. But I feel like before we even go to that, we really need to have a much better foundational understanding of what's happening with our brain. And because whenever somebody says to me, oh, I took that nootropic, it didn't work for me, I'm like, well, probably you weren't addressing whatever the shortcoming is in your brain. And so it's not going to work for you. Like you're missing the mark.
Yeah, and that's something that, is very important that you hit on, that I think is key, and that something that kind of also, makes me a little crazy when in the biohacking world is because, there are great tools that have been developed, and that's great. And even for clinicians and doctors, and I teach all over the world. And, the natural thing is they're like, oh, well, there's this helmet that has lasers and I can put it on my head. Isn't that great? And I'm like, no, it actually could make you worse if you don't know how are you using it?
Yeah.
How are you using the lasers, or what frequency are you doing, and what areas are you activating, or what areas are you inhibiting? So it really comes down to, we have all this happening, all these tools coming out, but very, very few people really have any clue what the actual problem is. So they're using these tools, and if you don't know why you're using the tools, then you are just as likely, or maybe more likely, to make things worse than you are better.
Yeah.
And so that's the thing. I've spent my whole career, and even now, like I said, I've published more papers last year than any other year in my career. More than ever, it's really about understanding what actually is happening in the brain, how the brain works, how it develops, what happens, what causes it to go off track, and then how do you correct that at any age group.
Great.
And using all of these tools, because we use all of these cutting edge tools.
Yeah.
We use them in very specific ways. I've created my own vitamin supplements. We use lasers and transcranial units and virtual reality and video games and neurofeedback and really high level physical rehabilitation. And we use, all different types of supplements and cutting edge functional immunology, and all of it together with cognitive skills and academic training. But we use it in a very specific and directed way.
Okay, great. So let's talk a little bit about some of these issues. Let's talk about the ADHD, we can, I don't know if you want to compartmentalize, like, are there groupings? Like we mentioned earlier, not here, but before we started recording, we mentioned ADHD, OCD, tics, anxiety, I don't know autism. Like, are these all very distinct? Are some of them part of the same sphere? Like, do you want to talk a little bit about the origin story, as it were, of some of these different things? And then we can get into things like neurodegenerative diseases that start to affect people later in life.
Right. So in the early 90s, Bill Clinton declared it the decade of the brain. And so all this new brain research came out, and all these new imaging tools where we could look at the brain in real time functionally, which had never really existed before. Mm-hmm. And so the idea of, we were able to look at what's actually happening in the brain. And during that time, it started to become apparent that looking at the brain, imaging it, taking pictures, and looking at measuring electrical activity or whatever, that there weren't, in the majority of cases, there wasn't any physical injuries. There wasn't damage to the brain. and that there wasn't any really clear genetic mutation most of the time. And that even at that time, the concept of biochemical imbalances was something that didn't really make sense. But what did make sense was a concept called functional connectivity, that the way that networks in the brain were forming, developing, and communicating, that almost all of the issues lived there, all of them. And what also became apparent was that when you looked at, the rise in the 80s and 90s of ADHD and OCD and Tourette's and tics and autism, and I remember going to a conference at the National Institute of Mental Health, and the woman stood up and said, there's a really high comorbidity of all these things. What does that mean? It means that, kids don't really usually have one diagnosis. They have multiple diagnoses. Mm. So are they separate and distinct issues that they all have, or are they all actual versions of the same underlying problem? Mm-hmm. And that's where the thinking was, that, we believe that all of this attentional behavioral spectrum, that there's actually a single underlying core root problem that manifests in different ways. And that's really where my research started, to understand that. So my lab and what we've done is we work on what we call functional disconnection syndromes, or functional disconnectivity. The problem was, I said, lived in the world of functional connectivity. And if that doesn't happen, it's called a functional disconnection, where areas can't really communicate and connect. But if you take a picture of the brain, or you measure it, or you do blood works, everything pretty much looks okay. And so that's where it lives in that functional world. It's kind of like, even though it's very different than a computer, the human brain, if you'd said it's like a software, it's like if your Wi-Fi goes down.
Yeah.
And there's nothing wrong with your actual phone or computer. There's nothing wrong with the software, but you just can't connect through the Wi-Fi.
Right.
And that's right. In our brain, it's kind of like this big Wi-Fi network. And if that Wi-Fi goes down, all types of things can arise from it.
And it can go down in specific areas. It's interesting, as you were talking and introducing this idea of all of them being interconnected, it's interesting that if you think about it, ADHD, where somebody can't hold attention, is almost the flip side of the coin of OCD, where somebody can't remove their attention, like they can't refocus, like they get stuck in a loop kind of thing.
Yeah, well, this is where, we were talking earlier about, I think a lot of people are mislabeled, or that's why I like to look way beyond labels, because like even, there's a right brain and left brain version of ADHD. There's a right brain and left brain version of OCD. And they're really opposite, but they may both be diagnosed together. And people don't realize that they're completely neurologically, from a neuroscience area, they're completely opposite. And so that's where even clearly defining, what do we mean by ADHD? What do we mean by OCD? What type of OCD is it? What type of ADHD is it? And that really matters, because, again, they're very different. And if you want to correct those problems, if you don't know what that problem is, if you don't know exactly what areas of the brain and what networks on, you're not going to be able to change it. And that's where people get frustrated and believe, well, I can't do anything to change this. Nobody can help me. Medication may give me some benefit, but it's really about being very clear about what areas of the brain are involved in. What do we mean when we say ADHD? What is actually, what are your struggles?
So let's talk about that a little bit, because, from what you're saying, or what I'm hearing you say, is it can be changed.
Oh, absolutely. All of them can be changed.
And I have someone very close to me who's very, very impacted by OCD. Mm-hmm. And there's now an adult. And went through a 12-week program at a major hospital in Toronto that not only didn't touch it, in some ways maybe made it worse, right? Yeah. And with this underpinning of anxiety, which I sometimes think, well, I'd be anxious too. If I had to live with this, you would be anxious and it would drive depression. Like, so it's a chicken or the egg thing. So let's talk a little bit and dip into the ADHD world and maybe the OCD world, because I think that there are so many adults that we come across now who are dealing with these things and trying to function again in a world not only that's changing, but that is becoming more competitive, and the bar is being raised, and these people feel like they might be getting left behind. And so if there's a way for them to be helped, like, we need to get that out there.
Absolutely.
Right? And the drugs aren't cutting it.
No. So a couple of things to that. First of all, I have a young adult in my family that also has struggled with OCD. And I also work with people that every day that have levels of OCD of all age groups. So this is to highlight what, my approach. You said your daughter worked at this place in Canada, or your child, or the person that you're talking about, right?
Yeah.
Did they ever explain to you what OCD is in the brain? What is happening in their brain? Did they ever explain that to you?
No, so I wasn't involved in this. It was, so I don't know.
Ever explain it to that person, do you think?
I don't think so.
I would be willing to tell you no, right? So again, the first question I ask any patient or parent that comes in, has anybody ever explained to you what is happening in the brain of your child and why they're presenting like this? And the answer virtually 100% of the time is no. Mm-hmm. Okay. So right off the bat, and I usually say, why do you think they didn't tell you that? And even people like, I've had top surgeons and, who have a kid with autism, and no one ever explained to them what the problem was. And again, no other doctor would do that, right? If you go to a doctor, they're going to tell you what the problem is, why it's relating to your symptoms, and what we need to do about it.
Hopefully.
But when it comes to any sort of mental health issue, they never give you any explanation like that, right? So for me, right off the bat, if they didn't tell somebody what it was, if they didn't explain it, it's probably because they don't know. And if you don't know, you're probably not going to help it very much, right? You may teach somebody how to manage their symptoms or be able to, lower the symptoms, but you're not going to really ever make significant change because you don't know what the root cause is. Mm-hmm. And if you don't get to the root cause, which is almost developmental. And the other thing that I'll highlight is this person that you're speaking about. Anybody that I work with, anybody that really has any significant issues like that, it usually starts with a gift. These are people that are very gifted. They have areas of their brain that are unusually strong.
Yep.
And those people are also more vulnerable to developmental imbalances.
Interesting.
And the imbalance is where the symptoms live. Okay. So, and there's different types of OCD. So this is my mentality on it. And you can give me, first of all, this person that you're speaking about, what are they unusually talented or gifted in, or what are they really good at?
Very, very empathetic, incredibly social, very, to the point sometimes, I guess, where like just a very empathetic, smart, like an intelligent person.
Right.
Right. But just has this demon to deal with that is just.
Did they do well in school academically?
Yeah.
Okay. And they had no issues with reading or with memorizing or, no problems with any specific things?
I think that in this case there was a brain trauma at birth that probably contributed to the situation dramatically. And I don't know that anybody's drawn that line. I mean, people have probably drawn the line, but I don't know that anybody's ever particularly addressed it in that way, which becomes a much more physical injury, if you will.
Well, that would be able to be seen then. Is there an MRI or something that shows a physical injury to the brain?
No.
Okay. So again, even if there was, then, that we should be able to say, okay, this is the area of the brain, but in most of the case. So I'll give you two versions. There's one version of OCD, which is more the classic, typical version in neuroscience. And this is where there are 4 different categories. One is around hygiene, like washing hands. Mm-hmm. Another is about checking, checking lights, checking. Another is about symmetry, making sure that, things are, organized and lined up and not moving. And then there's also hoarding, right? Now, this is typically generated by overactivity of certain networks that are associated with the left brain in an area called the basal ganglia, and in particular, the dorsal lateral prefrontal cortex and the orbital frontal cortex. And that causes an imbalance in that area. And the right brain normally should stop those obsessive thoughts or those compulsive behaviors. And there's stereotypical behaviors and functions. It's like a tick. It's like a physical
tick, behavioral tick.
But it's a behavioral or cognitive tick.
Yeah.
Then there's a different type of OCD. Now that person has like no control over that. It just kind of happens.
Yeah.
And they're aware of it, but again, it's involuntary. Mm-hmm. Then there's an OCD that is more people that are right brain dominant. And this usually starts early in childhood with them being overly emotionally intelligent, meaning that their emotions in themselves and their awareness of others' emotions is so high that it usually leads to a certain level of emotional and social anxiety. Mm-hmm. It creates like a stress response. The right brain also generates a sense of danger and fear, so that they have this anxiety from they feel like they're going to be judged. Their biggest fear is to be rejected by social group, because ultimately fear of rejection leads to, in the old Stone Age, the only way we survive is if we're connected to the group. You get kicked out of the tribe, you're dead, right? Yeah. So there's this idea that but the right brain has this drive to connect with other people and to attach. Mm-hmm. And we want everybody to love us, but we're also afraid of being rejected. And there's also this sense of danger that may be there. And then there's also embarrassment, shame, and guilt that is connected with that. And so all of that in kids, let's say with dyslexia, which is a left brain deficit, we know that can be overwhelming.
Right.
And that can lead. So these are people that might be overly empathetic, but feel like everybody's judging them negatively, and they judge themselves. And then they may adopt a type of OCD, which is a ritual to ward off bad things or to stop them. And they may ruminate on these negative fears. And so like my daughter did this, and I never knew this. She hid it from us. Not, in a negative way. She just didn't. So she had this, she would never sleep at night and never knew why. And she seemed like the happiest kid as a kid. She did pretty well in school. She was a great athlete. She started singing from the time she was born. And, everything seemed great with her. She had a lot of friends, but didn't realize that she was basically borderline dyslexic. She struggled with spelling and writing. And that she wouldn't sleep at night, and ask her why. She was just, I can't sleep. Later on, she told us that she had these perseverative thoughts that I was going to die, or my wife was going to die, or someone was going to break into the house. And she was constantly this vigilant fear. So along with that, she adopted these rituals where she would have to touch something a certain amount or jump a certain way. And if she didn't, that might mean I might die, or my wife might die, or something bad would happen. And so she took it on as her responsibility to ward off these bad things by doing these ritualistic behaviors. She was directing it, but it was also like she couldn't stop it at the same time. Right. You understand?
Like she couldn't say to herself, well, he's going to be fine. I don't need to jump with my finger on my nose.
The sense of danger and this anxiety around it. The only way she could calm her anxiety was to go through this ritual, because for her, that was somehow going to stop it from happening.
Right.
And if she didn't do it, the level of guilt and shame and fear, because if it did happen, it was all her fault.
Right.
So when you talk about your person, which one do they fit?
I think there's a bit of both, but dominant, mostly the left brain.
The left brain dominant type?
Yeah, okay. But there's a little bit of the right in there too, but I would say the left brain dominates.
Okay, so with that, you usually get somebody that may be unusually gifted in an area, right?
Mm-hmm.
So with a left brain dominant person, they usually very good. The left brain is mostly about collecting data, right? Meaning that, it's very detailed. We form memories with the left brain when it starts to form after 3 years. It's about taking in facts and details and storing them and being able to recall them, sequencing them, you categorizing them, turning them into words, and using this to get certain goals or to do accomplish certain actions that we set in place. And they're usually really good in, memorizing things. They're really good with facts. They may usually do pretty good academically because academics is really geared towards the left brain.
Yeah.
So they may be early readers. They may, be very good at, spelling, and they may be hyperactive or physically active, but they may then struggle with some right brain skills. And that might be they don't read social emotional cues as much, or they misinterpret them. They may not get the big picture, so they may not be able to comprehend what they're reading, like what's the main idea of the story. They don't have that kind of common sense, or they may not have that intuitive sense that other people may have. Then on the other hand, the right brain dominant, these are people that might be very creative or really very social or, really innovative and really have they're very intuitive, but they may struggle with basic reading or with, doing math
stuff.
or,
Yeah.
remembering details and facts and doing things in a very linear, sequential way. So like my daughter, like I said, she started writing songs when she was 10 years old, like incredible songs. And now she's actually a really up and coming singer songwriter in Nashville. Zach Brown produced her album.
Nice.
He opened for him. So the gift leads a vulnerability.
Yeah.
Right. So the person you're talking about, again, looking at their gifts also gives you a sense into where the deficit is.
Yeah. Yeah. So, okay. So without getting too deep into this one case study, let's talk a little bit, let's back it up a little bit and just talk about, in cases like, we'll talk about OCD because we're talking about it now, but I'd love to move also to ADHD and anxiety, like some of these other issues that we're seeing prevalently. And it's funny, I feel a little bit that the mental health umbrella it seems to be to so many people so amorphous that people just throw their hands up in despair and don't know what to do about it and think that nothing can be done about it. Whereas I think that it sounds to me like the work you do is you bring it down to earth. You make it real. You define it. You say, this is what's happening. There's a concrete piece. And if we have a concrete piece, then probably there's something we might be able to do about it, which I think is such a more optimistic way of handling this than just saying mental health, right? Because mental health it doesn't mean anything and we can't touch it and feel it and see it. It's just it's this amorphous boogeyman, if you will, that we can't handle. So backing it up a bit. So now we've talked about, these two situations where people get caught in loops. Is there a way to break the loop? Do you find, and is it I would imagine it's not a behavioral thing. I would imagine there's a mechanistic piece to this of breaking, because they're actual physical neurological loops where neurons are firing literally in a circle, right? Is that what
in pattern.
In a very oversimplified way.
Yeah, no, you're right. So yes, the brain is a physical organ, and like a muscle, it develops and grows and functions based on use. And we have parts of our brain that regulate motor function and that grow and activate based on motor function. We have areas that are related to sensory function, light, sound, smells, gravity, temperature, touch, and that process sensory information. We have areas of our brain that are cognitive and work on executive functions and memory and attention. And we have areas that regulate emotions.
Yeah.
We have areas that regulate our immune system. We have areas that regulate our hormone system. We have areas that regulate our blood sugar, that regulate our heart. So it's all based on these areas, and to work on an area, and the right brain and left brain have different jobs in all of those areas.
Right.
Okay. And that's the advantage of having two sides of the brain, because we have so much flexibility. It's basically like having two brains in one. Mm-hmm. And there isn't a lot of redundancy, because that doesn't make sense in the brain, right? So, yeah, so physically, literally changing the growth and function and the way the brain will produce chemicals or respond to chemicals in specific patterns of activity, understanding there's a bottom-up development of the brain that is mostly driven by early movement and sensory exploration. And then the brain grows and comes down and regulates everything. But at the same time, the right and left brain are developing and differentiating, where the right brain develops first in the womb and for the first 3 years, and then the left brain comes in, and then they achieve a certain level of balance and equilibrium, and they should be normally a great flow and balance between them, and that is it. When any of that is disrupted, it's what produces the symptoms that we see: overactivity, overconnectivity, and too little. So let's use ADHD as an example, okay? So what is ADHD? Attention deficit hyperactivity disorder. So what is attention? Attention is one of the most studied things in all of neuroscience and psychology. There are basically 5 different types of human attention. 4 of them are primarily regulated by the right brain. But when we talk about the classic ADHD person, we really look at that there's what we call the ventral attention network, which is sustained attention and a more broad attention, right? Not highly focused, detailed attention. That's the only type of attention that the left brain does.
Right.
So not hyper focus, but just sustained focus that's a little bit more open and broad, which is what you need really to be in a classroom. Mm-hmm. It can't be too broad, and you have to be able to. So there's an attention deficit on the right side of the brain, and that is mainly in the parietal lobe and the prefrontal area. On the left side, we have an area that regulates physical movement that we talked about that may generate tics or physical hyperactivity. And that's an area called the supplemental motor area in the frontal lobe on the left brain. So when we have overactivity of that and underactivity of a similar area on the right side, we get an attention deficit and we get hyperactivity.
Right. So the right side's no longer tempering the activity, so the activity can go wild, kind of thing.
Exactly, because they inhibit one another.
Right.
They keep each other in check all the time. And sometimes they cooperate, but most of the time they're kind of, one is taking the lead and then the other, and this is the way it should go all the time.
Right.
And if anything happens where one side becomes too dominant, depending on what networks are involved, that's where we get a combination of too much and too little.
Yeah.
And that translates into symptoms. And that can have an impact on our immune system, our hormones, our digestive system, all of it, because the brain regulates everything.
Yeah.
So the answer is we need to quiet down the area that's overactive and build up the other. And by building the other, we do dampen that down, but sometimes we might need to use more measurements to do that.
Great. So how do we do that? Because again, we'll say that for ADHD, the medications that are used, they do a job, but they don't fix the problem, and they very often will create other problems. So they often, at least long-term, do not serve the individual.
No, if we just look at that model, right, we're talking about overstimulation and understimulation, and now we're using a stimulant medication. Mm-hmm.
Yeah.
So it's going to stimulate the underactive side, which may help a bit, but it also may overstimulate the already stimulated, which we know if you give too much stimulant medication to someone with ADHD, they get tic disorders. You understand?
Yeah.
And looking at it and saying that, well, what are we doing? Most of the stimulant medications are either trying to increase the level of dopamine or norepinephrine in some way. And supposedly there's a balance, but really it's not that simple, because part of the networks that are involved do involve dopamine, but on both sides. Mm-hmm. So, it's not really it's a dopamine. It's not really an imbalance. There may be too much dopamine on one side and too little on the other.
Mm-hmm. Could it be a receptor issue too? Like there's more density of receptors on one side than the other?
But that would be as a byproduct of the use. It wouldn't be something that caused it.
Right. Okay.
Right? Because they should be equal. They should automatically be more, even though the left brain is more dopaminergic and the right brain is more serotonin.
Yeah.
But even so that's why, again, if you wanted to use something like, just something that would just stimulate the brain as a whole. Same thing as using medication that is a stimulant or some other medication that's affecting the whole. It may help one area, but actually make the other area worse.
Right.
And that's the problem with any generalized type of treatment. Whatever you're doing, that's why just doing physical exercise or just using lasers or light therapy or, just doing anything that is like, I'm just going to increase my whole brain health, it usually doesn't work that well, especially if you have a specific imbalance, because in that imbalance is where the problem lives. And the more unbalanced, the more severe the problem, the more gifted, and the more disabled that person is.
Wow. So how do you do it? What do you do?
It's really individualized to the person,
it's
right?
It's really individualized, yeah. But so let's say you have someone who's hyperactive on, who is that classic, has the hyperactivity on the left side and this underactivity on the right side. And you don't have to explain exactly, but clearly there's not. So we know there's no medication that's going to target the right side of the brain over the left side of the brain. So that's not an option. You could have the person run around in circles for a while. That may get rid of a little bit of physical energy, but it's not really going to address the cognitive delta that you're trying to break down. Although I think that helping these kids to not have to sit in a chair for 8 hours a day is not a bad thing. So in terms of the work that you do, what are the types of strategies that you're able to leverage to help to bring these and you said something really interesting. It's not just about shutting one down and turning one up. It's really about rebalancing. It's a little bit like when we say to someone, you need more omega-3. Well, you also need a little less omega-6. Like we're going to bring up the omega-3 and we're going to bring down the omega-6 to try and bring them a little closer together. Are there strategies that you can share with the audience at all that can help to kind of reduce that delta a little bit to bring a little bit more balance into the brain? Or is it so technical that you just have to go to see someone in a clinic?
No. And again, if people really want to, get a better picture of it, my book, Disconnected Kids, I really go through it in fair detail.
Yeah.
And my other books to a certain extent as well, too. And I've written papers also where we get into it in great detail. We published a paper in the British Medical Journal last year that really goes in detail as to what we did in our study. But
let's do a 10,000 foot view.
Yeah. So first of all, as we said, it all starts in childhood.
Right.
So the first thing we need to do, and one of the things that tells us, was there something that went off in childhood that altered the normal growth pattern enough that it kind of led to this imbalance that has become more imbalanced? And that is one of my main areas of research. It's called retained primitive reflexes. Mm-hmm. So looking at early development and milestones, or even pre-development, we go back all the way to before the beginning, meaning we look at, did you get into the right position in birth?
Oh, wow.
Babies are miraculously what we call pre-birth movement. Mm-hmm. Pre-birth movements are really these programmed movements called primitive reflexes.
Yeah.
And they are there, and we're all born with them. And first and foremost, they're used to get the child to get into the right position for being born without the cord wrapped around their neck and getting down into the pelvic that stimulates the birth process. So if we have somebody that was a breech presentation, didn't get in the right way, had the cord wrapped around their neck, didn't get down deep enough, the mother needed to be induced, whatever, right off the bat, we're saying, okay, those pre-movements weren't really there when they were supposed to be there.
Mm-hmm.
Okay, which may be because the brain is already being hindered a little bit in its developmental trajectory. And then those movements are there to help the baby actually go through the womb and push themselves out. If they don't come through the womb and they get a C-section, they don't use them. And to get rid of them, we need to use them. But if they're not there, we can't use them. Also, really kind of the end of the birth process, the baby is kind of pushing themselves out. So if a child gets stuck and needs forceps or needs, vacuum because they're not progressing, then that's it. And then we look at many of the people kids we worked with, they can't latch on and breastfeed right away because, again, that rooting and sucking reflex isn't fully there and they have low tone. And then they may not roll over, and then they don't do the commando crawl, and then they don't crawl the way they're supposed to for the way that they're supposed to. And at 12 months, almost exactly, every kid should be walking a few steps, talking a few words, and have good eye contact and point. Mm-hmm. If they're not, if it's significantly delayed or early, or if they skipped it, all of it shows that, all right, something is going off track. Now, the people that are most likely to be off track are ones that are unusually gifted in one area of the brain. So they may also be recognized as being really good or gifted in early. And so it kind of is like, all right, yeah, they didn't crawl, but they're really smart. Yeah, of course, they're not great socially, or maybe later on they might develop tics. And we got to remember, our brain is still developing probably till we're 50. We hear that the brain is developing till we're 25, but the main study that did that everybody talks about only went to 25. But we know that the brain is myelating up till we're 50. Yeah. So anything that happens in those first 6 years, especially, may not show up. It may show up in the first 3 years, and that may look like autism. It may show up in the first 6 or 7, which is maybe classic ADHD. It may show up, when you're 10, 11, 12, 13, and that may be dyslexia or a learning disability. It shows up in the 20s when it's schizophrenia. It may not show up till 20s or 30s when you're bipolar. And then ultimately, I think that if you have an altered trajectory up, you have a faster trajectory down, and then you start looking at neurodegeneration like Parkinson's and other things like that.
That's so interesting. I mean, it's almost like, and this is going to be a really beyond crude analogy, but you're almost talking about a tire that's installed just a little bit off on a car. And depending how far off it is how severe the dysfunction is going to be, how it's going to wear out, and how long it's going to take for you to notice that there's a problem with it.
Exactly.
And that's super interesting to me. So, okay. So net, it can start at birth or before birth, as you said, like while the child is in the womb, and then evolve in certain ways. But then before we started recording, and I don't know if there's something else you want to touch on in that area, but I want to be mindful of time a little bit. And we talked about something really interesting before. Well, we're talking about interesting stuff now too, but before we started recording, we talked a little bit about what are the things in our environment now that could be possibly, and I don't know now if you would say that they're in some cases creating the problem, or if they're just exacerbating a problem that might have been, like, is it possible that the brain could correct itself in less severe cases and things could rebalance in childhood in a world where the child has a healthy childhood, they get enough movement, they get the right inputs? Could slight imbalances sort of even out a little bit? But are there things in our environment today that maybe just pushing things even more out of balance? So, which could be why we're seeing the seemingly epidemic levels of whether it's ADHD or anxiety or autism or all the things that we're seeing, and kind of catchphrasing it in this mental health crisis that we talk about.
Yeah, my third book, called Autism, the Scientific Truth, is really not just about autism, but it's really about what causes all of these issues.
Mm-hmm.
What are the genetic and epigenetic environmental factors that are pushing this? And that we are, in fact, facing this epidemic without a doubt. And yeah, there's a lot of factors. They're almost all lifestyle driven. They almost have to do with the fact that, we're moving less at earlier and earlier ages, and that we're not, we have more chemicals in our environment, and we have our food isn't as great, and there's more inflammation in general, and it's impacting both moms and dads and the expression of their genes. And the genes that regulate the brain are the most susceptible by far of any genes, and they're 85% of our genes. So, there's a lot of issues there. And so Ian McGilchrist is somebody that, I think is great. He is similar in vein from me from a standpoint of how he looks at things. He's a psychiatrist out of the UK. And he talks about how, since the beginning of Western civilization, we've been moving more and more towards a left brain world and towards promoting left brain functions. And that is accelerating as technology accelerates, right? Our academics, psychotherapy, the way we look at medicine, the way we look at education is all been moving there. And that is partly, again, tipping this. And we're all susceptible to it in a certain way. And it's having an impact on us. And then that gets perpetuated in our kids because, anything that's going on in the parents can alter their gene expression, and that can be passed on to our kids. And then that alters slightly the way their brain is developing. And then that can lead to these imbalances and and lead to these issues that can become accelerated. And we're kind of rewarding it. So like when we look at something like autism or schizophrenia or bipolar, there was an article called The Puzzle of the Unbalanced Mind. And it starts off by saying that, when we look at evolutionary fitness, which is defined as having children, okay, meaning that if you're going to pass on your genes, in evolution, obviously, everything is designed to try to make it that you pass on genes and you pass on better genes that are going to lend to more survival in your offspring, right? Yeah. So when we look at it, and again, we're hoping we're going to change all of this, but in most people with autism, they don't have their own children. Most people with schizophrenia don't have their own children.
Right.
Most people with bipolar will commit suicide, unfortunately, at 5 times the rate of the average. So they don't have as many children. So you would think that the genes, if it was purely a genetic disorder, that those genes would be going away because they're not being passed on.
And they're not.
But they're actually increasing at an increasing rate. So what does that mean? It means that it's not a genetic mutation, but it's built on genetic traits. And at one version or in those traits, it actually gives a great advantage that seems to be increasing in our society. And what is that advantage? That advantage is people are a little bit more left brain dominant and they do better that way. And so therefore that gets accelerated over the years because now you're promoting left brain development, left brain skill, left brain people, and that they're having more left brain kids, and our society is pushing it towards that. And when you get to a certain level, it now becomes, you go over what's called an evolutionary cliff edge, it now becomes a distinct disadvantage.
Like a pathology almost. Yeah.
Right. But leading up to that, it gives you great advantage. And anybody really gifted is automatically unbalanced by definition. But you can get some people that are so well balanced and use their whole brain really great, which is the ultimate goal, I think, of everybody.
Sure.
But we all kind of favor one side or the other a little bit. So some level of an imbalance gives great advantage, but there's also a deficit. The advantage is outweighing the deficit until it gets so far down that the deficit outweighs that. And now it becomes a disability, and now we label it, and now we try to fix it, but we don't know what the problem is. And again, we throw things at it that may, not really deal with the root problem.
Yeah. Yeah. So what role do you think technology is playing in all this? Like the overexposure of small children to screens and phones and computers, and it's only accelerating at this point. And what are your thoughts on that? Because I think as parents and people getting into parenthood, it seems like the train's left the station. There's nothing they can do anymore. And I don't know what your thoughts are on that, and also maybe if people understand what it's contributing, it's worth the effort to stop it, because there's a small group of people that's checking out.
Yeah.
They're pulling their kids out of school, they're homeschooling them, they're homesteading. It's not a lot, but there seems to be a bit of a growing movement there of people saying, you know what, this world is not healthy for my children, and I'm pulling them out.
Right. Yeah, I think that technology has been driving all of this from the very beginning. Because, and not that, I love technology. I think it's great. I think it's incredible. But it has altered our lifestyle more than any single factor in human history, right? Just look at what's happened over the past 30 years in everyone's lifestyle. Mm-hmm. When we grew up as kids, nobody had a phone, nobody had a computer. You were outside every day. You were riding bikes. You were climbing trees. You were socializing with people. You had to navigate that environment. You had to navigate school. You had to read books. You had to, memorize people's phone number. You had all of this stuff. And that all went away with the development of technology. And with awareness and with fear of letting our kids go outside and that bad things might happen. So I think technology is driving all of it, but not only because of the way of the impact of the actual technology on the brain, but mainly because as we do more of that, we do less of all the things that really our brain needs, and especially movement. Yeah. We become so sedentary, which we know is the driving force between obesity, diabetes, and heart disease, which is also rising at epidemic levels, and inflammation. But it also, especially early on, is the main thing that drives brain development. Movement drives brain development, and that movement drives sensory stimulation, and that's how our brain grows and develops. And the foundation of our brain is formed in those first 6 years. And developing this delicate balance is there. Now, if we stop movement and we introduce technology, which most technology, most phones, most software, most video games are really designed to stimulate more of the left brain.
Yeah.
And that's also where the addictive parts of our networks are.
Yeah.
So now what you're doing is the right brain. Childhood, especially the first 3 years, is really about development of the right brain. That's the foundation of socialization, of attachment, of connecting to our own body, emotional regulation, security, sense of self, self-awareness, body regulation of all of our hormones, and the development of our parasympathetic nervous system. All of that develops in the right brain primarily in the first 3 years, especially year 1 to 2. If you introduce technology early on, it stimulates the left side of the brain, and you bring that on too early, and you stop that development on the right side.
Interesting.
And movement also has an impact on both sides of the brain, but especially gross motor movement is more for right brain. So technology does have a direct impact on that. It creates imbalances. And virtual reality is going to create incredible differences in the brain. But also it's mainly about how it's altered our lifestyle, so that we move less, we interact with people less, we're not outside, we don't have to problem solve as much, we don't have to remember things as much. We usually eat more food when we're sedentary, we eat a lot of more junk food when we're sedentary, we put on weight, we gain fat creates inflammation. So it's a roller coaster, And so it does drive me crazy when I see people, especially in the first 3 years, throwing their phone or throwing an iPad. I don't think a kid should see any screens. Maybe a TV show from a distance about, nature, but they should not be using any high level technology, and certainly up close in the first 3 years, because that really, and we know that, most of the worst mental health issues really have to do with developmental delays on the right side.
Wow. That's pretty profound. And can it be correct? And so you're saying, yes, it can be corrected down
Yes,
the road.
that's the good news. It's never too early, but it's never too late. We can correct this at any age. The only problem is when you get to like teenage years or adulthood, especially if people are really lack self-awareness of their own level of disability, you can't make them do something, right?
Yeah.
A small child, you can make them do things that they might, not be all happy about, or they'll do it just because you ask them to do it. But at a certain point, it gets hard because, they have to be willing participants to change their own brain. You can
It's
do
not easy.
you can do some of it passively, but again, you can't even do anything passively if somebody just says, "No, I'm not doing anything about it."
Yeah. Yeah, for sure. Okay. Well, I mean, how many books did you say? 8?
Yeah,
So we're not.
well, if you count all of my different editions of books, so yes, I have written, I think, 7 or 8 books. I have 3 editions of Disconnected Kids, and yeah, so and one major textbook, and then 7 more trade publications, and about 100 papers that I've published, and many articles and text and chapters. So
Okay.
that's the whole thing. Everything I'm saying, I've actually researched and I've actually published on it. So nothing I'm saying, besides the fact of, basically 30 plus years of clinical experience, I don't say anything that I can't really, point to something that I've seen or researched or other people.
Yeah, no, and it's pretty fast. And I know that we talked about this earlier, and you mentioned it, that you recognize that nutrition plays an absolute role in all this. But it sounds to me that if you're not addressing this more physical aspect of these imbalances, you can feed all you want. That's not going to do the work that really does the heavy lifting. So,
And that's a really important fact, because
yeah.
again, I teach some aspect of functional neuroimmunology, and I know functional medicine, and some of my best friends are functional medicine doctors really looking at diet and nutrition, and it's great. But their whole approach, and they're taught and they believe that everything starts in the gut, that everything in the brain starts with the gut. And that's wrong. It's not. It starts in the brainstem, which regulates the gut. And the brainstem is the root problem. The gut then becomes the secondary issue, and it does produce inflammation and it does cause problems, and you can get great benefit by addressing it, but it is not the root cause the vast majority of time.
Interesting. That's a very different take, and it's a chicken or the egg discussion that goes on all the time, right? So most
people don't understand how the brain regulates the gut and digestion. And yes, it's a two-way street, but most people don't know enough about the brain and how the brain grows and develops and functions and regulates the parasympathetic and sympathetic nervous system to really make an informed understanding of that. But they may understand the gut really well, and they understand the immune system really well, and they understand that. And so obviously they favor that's what they know. They don't know the brain part, but I'm telling you, the brain part is actually, in the majority of the time, if you know that, then you realize that, oh, this part is secondary.
Well, it sounds like the silos have got to come down. I think that addressing the brain part is really important, but then if you don't address the gut part and the nutrition and the inflammation and all the things, you're only going to be able to get so far. So
Absolutely.
They're not mutually exclusive. They're actually part and parcel of the same puzzle. So, okay. So In the interest of time, I'm going to invite you to do three things. The third thing, which will be the last thing, is to point people to your resources and to find you and the work that you do, and get, if they know someone, they themselves know someone who needs help, to be able to find that. But before we get to that, I'm going to invite you to share with the audience what are five things they need to, what are five things that everybody can do in their own lives to have a better brain, um, just to age better and to be happier. And let's keep it general for now. I think that, and maybe we can have two different groups. We can have a group that's been diagnosed with some condition, and then we can have a group that's blissfully unaware of any condition they may have, that's going around saying, I don't have ADHD, I don't have a mental health issue. So what are the things that each of these groups can do? Because I think it's going to be a little bit different.
Yeah, well, first, I think, just learn more about your brain and how it works in your brain. Are you more of a right brain or left brain dominant person? People don't know that, and understand it. And has that show up in your life, right? Mm-hmm. And do you have really good skills that are maybe beyond many people? Do you also struggle with things?
Yeah.
And get a picture of that. I always say, most people know more about their heart and their gut or any other organ but their brain, and their brain is really the most important. And in regard to the brain, the number two thing I think that's most important is people have to move more. Get away from chairs, move. And if you can incorporate it into your daily routine, like if you could actually, what I'll do is when I'm at home, if I'm working and doing a lot of Zoom, and I am walking on a treadmill,
I have one right here.
Very slowly, as I'm doing this, and I exercise in some way every day, whether it's just some push-ups or I do dips or I lift weights or I go for a run. But even just consistently getting off your butt and actually moving. If you were to walk at, like, let's say 1 to 2 miles on a treadmill all day while you were working, or most of your day, you would never have to go to the gym. You would never have to diet. You would never have to really work, because you would be healthy. You wouldn't have back pain. You wouldn't have neck pain. You wouldn't have headaches, and your mental health would be tremendously better. Number three would be, you have to look at how you eat. Most people eat crap. Most people eat too much. You need to look at your body fat percentage. If you're overweight, if you have too much body fat, that is a source of inflammation. You really need to watch what you're eating. You need to modify your diet. You need to eat healthier, take in less calories. Look at something like intermittent fasting, which we know is awesome for the brain and for your health. And then four, I would say you need to take supplements. Most people, their gut and their body is not working, optimally, and we are vitamin deficient. And we need to be able to, do more, and we need to supplement. We need to supplement with some, and I take every day vitamin D, omega-3s, a probiotic, prebiotic, a multivitamin of some sort. And then I take a lot of other vitamins or supplements to enhance different things that I want to enhance on. I take a glutathione spray every day and for detoxification and all of that. And then I think the other thing is, try to always be pushing yourself into areas of being uncomfortable. Like most of us get into habits and routines. Just change your routine. Do things differently. Always change things up. Always put yourself to do things that are uncomfortable. Move more, right? Like, I have an office in New York City, and I come out of Penn Station, and there's a big, huge escalator. I always take the stairs. I never take the escalator. Most people always just don't do that. Yeah. Little things that can change. And I think those would be my 5 things.
Yeah, well, and those are pretty global. Those are great. And the understanding your brain and getting an idea of your brain, I think, is the starting point, and then can direct you in different avenues. So, Dr. Melillo, where do they find you? Where do they connect to your work? How do people learn more about what you do?
Yeah, I have my website, drrobertmelillo.com, has, a lot of resources on there. I'm also very active in social media. I almost have 1 million followers on Instagram. So nice. At Dr. Robert Melillo on Instagram. I think there's a little bit on X and Facebook as well. But I also have a YouTube channel under Dr. Robert Melillo where we have a lot of videos. I did a TED Talk a couple of years ago that TED refused to put up because they felt like it was too outside of the box for them, which is incredible.
That's
but
ridiculous.
It's up there and people can see it. I also have two podcasts that I do. One is called the Melillo Method Podcast, Everything Brain. And the other I do with my daughter is called The Right Brain, WRITE, which is geared towards that right brain creative community and that anxiety and social anxiety and all of the things that we talked about that, she wanted to bring to her community, because they all struggle. Like all of Nashville are these big right brain dominant creative people that all have this horrible anxiety and imposter syndromes and poor self-esteem, but they're all these amazingly talented people. And then my book, Disconnected Kids, is the best-selling book. I do have two professional courses. One is on a behavioral immunology, functional neurology course that people can take online. And then I also have an advanced clinical functional neuroanatomy course that people can take. And there's a lot of other resources out there.
drmelillo.com, I think, would be a great place to start.
drrobertmelillo.com.
robertmelillo.com. I apologize.
Yes.
Well, thank you so much for your time today. This has been a very enlightening discussion, and thank you for your work. It's awesome.
Yeah, no, great. You do a really good job. I mean, this has been a unique experience, so thank you.
Thank you.